Have you ever looked at an ECG and just felt your mind go blank? You see all those squiggly lines and a little bit of panic sets in, right? Well, what if I told you that in just the next few minutes, you're going to learn a simple, systematic method that turns all that chaos into a crystal clear conversation with the heart? This isn't just about getting a question right on a test. This is a skill that can literally save someone's life. Okay, so let's get right into it. We're going to cut through all the noise and give you a foolproof 7-step checklist. This is the kind of framework that makes sure you never, ever miss a critical finding. It's going to take you from feeling completely overwhelmed to feeling confident every single time you look at an ECG. I want you to think of this method like a pilot's pre-flight checklist. You'd want your pilot to check every single item before takeoff, wouldn't you? Of course! We do the same thing here. We follow this order every time because a system is the only way to guarantee you see everything. It stops you from jumping to the big, scary thing on the screen and missing something more subtle, but just as deadly. All right, first things first, we have to check the absolute basics. Is a heart beating too fast, too slow? And most importantly, is it organized? This first step really sets the stage for our entire investigation. And to understand rhythm, we're going to use this incredible analogy, an army versus a crowd. Now, calculating the rate is super fast. All you do is find an R wave that lands right on one of those thick grid lines, then you just count the number of big boxes until the very next R wave. Take 300 and divide it by that number. So let's say there are 4 boxes. 300 divided by 4 is 75. Simple. Is it over 100? That's tachycardia. Under 60? That's bradycardia. Easy as that. So here's how we think about rhythm. A normal, healthy sinus rhythm is like a perfectly disciplined army. Every soldier is marching in perfect step. That means the distance between each R wave is exactly the same. But then you have atrial fibrillation, and that's a panicked crowd. There's no leader, there's no order, it's just pure chaos. The R to R intervals are completely irregular and all over the place. Army or crowd? That's the first big question you need to answer. Next up, step 2, the cardiac axis. Now, don't let that name scare you. It sounds complicated, but it's really just the main direction of the electrical current flowing through the heart. And guess what? We have a super simple trick to figure it out in literally seconds. This is called the thumbs up technique. It's so easy. First, look at lead I on the ECG. Is the QRS complex mostly pointing up, positive? If it is, put your left thumb up. Great. Now look at lead AVF. Is that QRS pointing up too? If yes, put your right thumb up. Now, just look down at your hands. And this tells you everything you need to know. Are both of your thumbs pointing up? Perfect. That's a normal axis. Is your left thumb up, but your right thumb is down? Well, they've left each other, so that's left axis deviation. What if your left thumb is down and your right is up? They're pointing right toward each other. That's right axis deviation. And if both thumbs are down, that's extreme deviation, something you'd see in a really serious situation. Okay, now we move on to the intervals, and we're going to focus on the PR interval. This little space tells us how long it takes for the electrical signal to travel from the atria down to the ventricles. But instead of trying to memorize a bunch of numbers, let's turn it into a story. The story of a couple's relationship and how punctual they are. Let's break this down. In a first-degree block, your partner is always late, but they always show up. The PR interval is a little too long, but it's consistent. In a Mobitz I, your partner gets later and later and later until one day they just don't show up at all. The PR interval progressively lengthens, then boom, a dropped beat. Now Mobitz 2 is more dangerous. Your partner is always perfectly on time, but then, out of nowhere, they stand you up. A beat is just randomly dropped. And a third-degree block, well, that's the divorce. The atria and ventricles aren't talking anymore. They're completely doing their own thing. All right, on to step 4, the P wave. This tiny little bump tells us a whole story about the atria, the heart's 2 upper chambers. We're looking for signs that they might be enlarged, and to do that, we're going to look for 2 very specific shapes, a camel and a mountain. Here's all you have to remember. If you have left atrial hypertrophy, the P wave gets wide and develops a little notch in it, so it looks like the 2 humps of a camel. You can remember the M shape from mitral valve disease, which is a common cause. Now, for right atrial hypertrophy, the P wave gets really tall and pointy, just like a mountain peak. So camel humps for the left, mountain peak for the right. Now for the main event on the ECG, the QRS complex. This represents the big squeeze of the ventricles. We're looking to see if the QRS is too wide, over 120 milliseconds, because that tells us there's a delay, like a traffic jam in the heart's wiring. This is a bundle branch block, and we've got some great ways to spot it. For a right bundle branch block, I want you to look in lead V1 for a pattern that looks exactly like a pair of rabbit ears. I'm serious. Once you see it, you'll never unsee it. For a more technical way, you can use the mnemonic William Morrall. If you see a W shape in V1 and an M shape in V6, think William for a left block. If you see an M in V1 and a W in V6, think Morrall for a right block. It's almost like the heart is using turn signals to tell you exactly which side is blocked. Okay, everybody take a deep breath. We have arrived at the most critical, the most time-sensitive part of the entire ECG, the ST segment. This little piece of the line tells us if the heart muscle is actively being damaged from a lack of oxygen. In other words, a heart attack. This is where you can truly be a hero. When you see ST elevation, there is one question you absolutely must ask. What is its shape? If the segment curves upward like a smiley face, we call that concave. This is often seen in less scary conditions, like pericarditis. But if it's convex, arching downwards like a frowny face, or even a tombstone, that is a massive red flag. That is highly suspicious for a STEMI, a major heart attack. One smiles at you, the other one is a sign of impending doom. You have to know that difference. So what if the ST segment goes down instead of up? Well, that's ST depression, and it's a sign of ischemia. That just means the heart muscle isn't getting enough oxygen. Here's an analogy. Imagine the heart is struggling to carry a really heavy backpack. The baseline sags down under all that weight. That dip is the ST depression. It's a sign of distress. And once you've identified that dangerous tombstone-shaped ST elevation, this chart becomes your map to the emergency. For example, if you see those shapes in leads V1, V2, V3, and V4, you know the damage is happening on the front wall of the heart. If you see them in leads 2, 3, and AVF, you're looking at the bottom wall. This chart doesn't just tell you that something's wrong, it tells you exactly where the fire is. And there we go. We've walked through the entire systematic process, step by step. You now have a powerful, repeatable checklist that you can use to approach any ECG with total confidence. You've turned something that was probably really daunting into something totally manageable. So let's put it all together one last time. Here is your 7-step checklist, framed as 7 simple questions. 1. Rate, fast or slow? 2. Rhythm, is it an army or a crowd? 3. Axis, are your thumbs up? 4. Intervals, is our couple on time? 5. P-wave, is it a camel or a mountain? 6. QRS, do you see any rabbit ears? And finally, the most important question of all. 7. The ST segment, is it a smiley face or is it a tombstone? Okay, let's do a quick knowledge check. Pause here if you want a second to think. An irregular rhythm with no visible P waves is most often B. Atrial fibrillation. Why? Think about our analogy. It perfectly describes that panicked crowd. No clear leader, which means no P waves, and total chaos, which means an irregular rhythm. I want you to remember this. An ECG is not just a bunch of lines on a piece of paper. It's a language. It is a direct conversation with the most important organ in the human body. And after today, you're no longer just looking at it. You are an interpreter. You now understand what the heart is trying to tell you. Before you go, I've got a quick question for you. Which of the analogies we talked about today stuck with you the most? Was it the army and the crowd, the couple's relationship, or the smiley face versus the tombstone? Let me know down in the comments. Hearing what works for you helps everyone else learn too. Thanks so much for being here.